Thank you, Devin. There are many great treats and foods that we enjoy during the holiday season, but sometimes our body doesn't enjoy the food quite as much as we do. And here this morning is Nurse Christina Paris to talk to us a little bit about a common happening, acid reflux.
Yeah. You are right. There are things that are so yummy, but so bad for us.
The body doesn't like it as nearly as much as we do. So tell us a little bit about what is acid reflux.
Sure. So, as we chew up food, there's things in our body produces, which is bile and saliva, to kind of help break down food, but they can also be very acidic. What happens is with some people with certain issues or concerns, that bile and that acid can go back up the esophagus. So we have the trachea, that's the windpipe. That's where the, when we breathe in, goes to the lungs. Then we have the esophagus in the front, that goes to the stomach. So when bile and those fluids kind of back up into the esophagus, it can be very uncomfortable. It can cause an irritation. And, people who are obese, people who have things like hiatal hernias, that's a bulging, and that can cause that backup as well. We have muscles actually at the base of our esophagus. And so when those weaken too, so they can't close off to stop stuff from going up, that can cause those symptoms to happen as well.
Oh, okay. So speaking about these symptoms, if, the muscles get a little weaker or for whatever reason that bile does get into the throat, what sort of symptoms are we going to be looking at?
Yeah, so you're going to have, they call it heartburn, because you're going to have kind of a burning sensation, a burning feeling in your chest. You might even taste some acid or just a bitter taste in the back of your throat. Sometimes you might have stomach pain, difficulty swallowing. Some people, if over time you get that acid up in there, it can actually irritate the vocal cords, which can cause a sore throat or a raspy voice. Some people will get an unexplained cough. If you have a chronic cough, you're not a tobacco user, you're not, you don't have lung issues, COPD, things like that. It could be due to acid reflux. And then nausea and vomiting. Some people can get that as well.
Oh, goodness. All right. Well, all good things to keep on the lookout for. So when at any of these points do you contact your doctor?
Right, so absolutely, that's a really good point. So acid reflux can give you chest pain or discomfort, but heart-related issues can also mimic or be similar to that.
Right.
When you have a cardiac related event, you are going to have some chest discomfort. You are going to possibly have nausea or vomiting. And so, when you have those symptoms, absolutely you want to go in and get checked out. If, you're pretty convinced even that it's heartburn, that you're feeling, you can taste it, you just know, that irritation can cause ulcers, can cause long-term problems, can put you at risk for cancer. So you want to make sure that you're going in and talking to your doctor if you're noticing these symptoms, that cough that you can't figure out or get rid of. They're going to rule out a bunch of different things, do tests, and see if maybe that's the cause of it.
Because I can't imagine the bile in your throat. It's not meant for that, right?
And there's tests that they can do to check the pH of your mouth. Then there's, of course, blood tests that they can do, things that they can check to see how things are functioning. Like they can do an upper GI where they go down with a scope into your throat. They can look and see, how does the esophagus look? How does the stomach look, the lining? And that gives them a good view of what's going on, too.
So are there any specific foods or things to avoid heartburn, or does it just, person specific? So,
there are things you can do. Of course, if you talk to your doctor, you can always try like over-the-counter things like Tums, Prilosec, is some of those medications, Rolaids, Pepto-Bismol. Pepto-Bismol seems to be, for the older generation, the go-to medication for everything related with the GI tract. And I looked it up, by the way, and because I was curious, it, I guess, really is the go-to. I don't know. It does a lot of stuff, but I don't.
I got Pepto in the medicine cabinet.
Oh, of course. It's not one I like to use.
It's for everyone. I remember, oddly enough, I started working here roughly 3.5 years ago at Newswatch 12, and one of the first one of the first and only gifts I got for joining the station was someone gifted me a bottle of Pepto-Bismol.
Oh, that's funny.
It wasn't for any specific reason. This was the only thing they had that they didn't want to have. They're like, here you go.
Funny. Yeah.
So I have that at home in my cabinet, and
In case things
it's
get
got some dust.
stressful, in case the news gets, intense. Yeah, good to have. No, but things like fried fatty foods, alcohol, tobacco use, things like that can also irritate the esophagus, your mouth. Potato chips, pizza. I mean, everything.
So everything I enjoy is what you're saying.
Yeah,
Okay, well,
but citrus also can be a trigger. So, you want to have things like bananas, melons.
Okay.
You want to eat broccoli, fruits and vegetables like that, whole grains.
Well-balanced.
Root vegetables, exactly. Cauliflower, nuts, celery, watermelon, that kind of stuff. Herbal teas can kind of help. Sometimes something with a little honey, an herbal tea with honey or ginger. Those are good for the tummy.
Well, fantastic. I'll keep that in mind this holiday season.
Yeah.
I'll try to get a couple of those mixed in there, and we'll all be right as rain.
That's right. Everything in moderation. If you ever have questions or concerns, always go to your doctor.
Thank you so much, Nurse Christina. Always appreciate taking the time this morning.
Thanks.
All right. Well, we'll be right back with your daily dose of What's Trending.